got Dr. Seshni on right now, and I'd like to say good morning to you, Dr. Seshni. How are you?
Good morning. Good morning. Good morning.
Yourself? Oh, yeah, you haven't. So, yeah. How are you this morning?
I'm great. Thank you, Poku. How are you this morning?
Everything is good. Right. COVID update, Dr. Seshni. You know, I can't believe that we started the COVID update today at 1:07. We usually start on the door or before that. But no, it's not your fault. It's mine because you've been on for a while now. It's just that there's not a lot of information on COVID anymore.
Well, no, there isn't.
You know what I mean?
Yeah. There isn't.
Which is good. It's a good thing. So now we can report less deaths, less infections, and all that. It's mainly, to be honest, Dr. Seshni, mainly what's going on is the vaccine situation, the AstraZeneca vaccine situation, and all that. But hey, let's see what we've got here.
No, you're right. The numbers have come down because I did check the 24 hours before we started. So the figures have come down. So we're looking at 110 deaths, every life matters in the UK, and in the last 24 hours, and 5,294 cases. So definitely the numbers have gone down, which is really good news. I think you're right. There's not that much to report as we've been doing all these months and for over this year. So you can sit back, relax, and enjoy your coffee. I've got mine at hand as well.
Indeed. Actually, I miss the studio, you know. I do. Our coffees and all that. But this is the situation now. Hopefully, we will be going back to the studio sooner rather than later.
Yes. Anyway. The only story, I would love to be in the studio. It was amazing. It's a bit different, I think. It's been like over a year now that we've been doing this. In terms of the COVID update, there isn't that much. So there is talk about the new variant, a Philippines variant, which has been found in the UK.
Oh, I haven't seen that.
So that is a new... Yeah, so that is a new one. So Philippines-linked variant investigated in England. So it's found after 2 cases. So the P3 variant that has come from Philippines, which currently has the second number of highest COVID-19 cases in Southeast Asia. So Public Health England is now investigating this new variant. They've given a long name, VUI 21 March 02P3. It's been designated a variant under investigation rather than variants such as other form, like the Brazilian one. So it's a bit different. So it's under investigation.
I've never heard that. This is the first time I'm hearing it. So that's why it's a good thing that we do this COVID update every morning. Every morning I learn something.
I mean, it is important to know these, but I mean, how is it going to help us? You know, when you're walking around, if you're going to catch coronavirus, we are not going to know which variant it is. But I think what's important is, why it's important is because obviously it's causing different types of infections. It's spreading differently. It's more virulent. It's spreading fast and it's causing more problems. So I think this is why it's important. So people might ask, why do we need to know these? And also because of the vaccine rollout, whether the vaccines will then be effective or for these variants. So they say that obviously this variant includes a notable variations and mutations such as the E484K and the N501Y. And then the P1, which is the Brazilian. So, you know, we have the South African, the UK, the Brazilian, the Nigerian, and then the Philippines. There's been a few others in other countries as well. But I think now they're just talking about the Philippines. And why it's a concern is because Philippines is the second highest in Southeast Asia. So I think this is where the concern is coming in. So they just it's under investigation, basically. They found 2 cases. But in Philippines,
in
the UK, they don't say where exactly in the UK.
Oh, in the UK,
but I suspect it might be somewhere like London, or I mean, it depends where people are traveling from. I think this is where we're going to get it. But they did say that this P3 was It's on the watch list, and it has been detected in Brazil, in Philippines, in 33 other people. So in Philippines, so it makes this, so it makes it more transmissible. So this is what, like we said, the concerns is how it's transmitted, how it's transmitting faster, and also if the vaccine is then going to be able to be protective or effective against this variant. So this is all the concerns, yeah.
Right. Talking about vaccines, the Oxford AstraZeneca COVID vaccine is safe. That's what the health secretary is saying. You know what's going on in Europe? They're complaining about the vaccine, saying that it's giving certain side effects like blood clots and blah blah blah. But our health secretary said that it's safe, and he's advising that people go and take it.
I saw that. What do you think of that? So Matt Hancock is insisting that the AstraZeneca COVID jab is safe, and that urging people that they need to go. And he's spoken after there's been concerns over the blood clots, as you said. He said, listen to the regulators and get the jab as soon as you have the opportunity. And we know that in some 13 countries, including Ireland, Denmark, Norway, Netherlands, and a few other places, they've all suspended the use.
Or not banned it, suspended it. Sorry.
Suspended the use. So I don't know what you make of that, but he's saying that the MHRA, the World Health Organization, and the Emergencies Medicine Agency all believed that the vaccine was safe. I don't know what the outcome is of the WHO meeting. I haven't seen the WHO.
I haven't seen it too. I searched. I didn't see anything.
Yeah. So we'll try and get an update on that. But yeah, I'm not sure what to make of that. I think at the end of the day, it's going to be every person's choice. A medical disclaimer, you know, if anyone's is considering taking the vaccines, they need to go and find out the information from the local health center, the GP, the nurses. Look online, look at the government website, make an appointment and discuss it with someone that's professional and dealing with it, and then make your decision. So I think that should be a disclaimer.
Yeah, you're asking what I make of it. This is what I think personally. Me,
yeah.
If I'm gonna get the jab,
yeah,
and if I'm assured by my GP that it's safe, I'll take it. Honestly, I will. I mean, the government, the health secretary, everybody else will say it's safe. WHO, they're saying it's safe, and but there's no evidence that links it with the blood clots that was found in people and all that. And Europe, some European countries are saying they're not too sure, they're investigating and all that.
Yeah.
But I was watching the news not late last night, sometime around 2 a.m. today.
As you do.
And I was watching Sky News, and people are suggesting that the European countries are sort of trying to sabotage it because of obviously the way things went with the supply and the delay and all that. I don't. That is what somebody's saying, right? It's not mine. But at the end of the day, if I decide to go and get the jab, I have been invited to go and get it anyway. When I go, or if I go, and I will ask my GP, is it safe to take the AstraZeneca? If he says yes, I'll take it.
Yeah. I think that's important. That's why I said that. I think that's good advice, or the approach that you were taking for yourself. And that's why I said rather find out the information, because I was actually thinking about it yesterday, because I mentioned to you that there's family members and people that I know that have taken one or the other. And I was just wondering, when I spoke to them, I was even reluctant to ask them how were they feeling, because I knew we had the conversation when they took the AstraZeneca. And then afterwards, I was reluctant to even ask, how are you feeling now? Because I just didn't want to cause any alarm, because if they didn't know there was any concerns, I didn't want them to be concerned, because I'm just wondering, people that have had the AstraZeneca, how are they feeling, and how are they feeling for the second um, for second jab, So I think, to be honest,
No, I know a few people who have had the AstraZeneca jab, and
how do they feel like when they heard
they're
the
all right.
news?
They're all right. They're not one single person that I know who's taking the AstraZeneca jab has complained. They're
Yeah.
well, of course. Some of the, one person said they had a bit of a headache,
Yeah.
a pain in the arm, some sort of fever, and for a few hours, and that's it. End of story.
Yeah.
So yeah. Anyway, let's go on to the next story. The prisoners and the vaccine. Well, they're asking that they prioritize prisoners for coronavirus vaccine. The reason, there are many reasons really, but the main reason is that they're not the healthiest of people, if you know what I mean, because of their conditions and all that, both mentally, psychologically, both that and physically. So, and they're now, a lot of them are now living in isolation because of obviously COVID rules and all that. So it's affecting them. And so they're suggesting, researchers from University College London, UCL, they're suggesting that, look, let's make them a priority and give them the vaccine, vaccinate them.
Yeah, well, I think that's important, because prison, what comes to mind is, I've done a lot of medical legal work going into prisons, and
in the prisons, I know that
yeah, and then the health service, obviously they do have a health wing, and a mental health wing as well. So it is important, because they're not always able to get physical health care, and especially depending on what's going on in the prison, because sometimes prisons go into lockdown as well. I think my concern would be that that if one person did get it, because it's a large space and also lots of people in a prison at a time, anything from 500 to 1,000 to 2,000 and more, I would think that it is important for people in prisons to get the vaccine. So I do think it is really, really important. Yeah.
Yeah, I think so too. I think it is important that
Yeah, so I'm glad that they are, prioritizing it. And I think, but I think from very early on, they were very proactive, even with the guidance in prisons of, remember when we first started out, there were certain cases in certain prisons. Very early on, there were some prisons which had cases of COVID-19. And I think, to be fair, and the prison staff and they have been quite proactive in trying to prevent the spread of COVID-19 and dealing with it and managing it. So they've done really well, I must say, because we haven't heard much cases in the prisons. I don't know if you have heard, but I know apart from those cases we had very early on, I've not seen many. And if they have had it, they've dealt with it. It hasn't been to an extent where the prisons have had to close and go into lockdown. But having said that, the country's in lockdown, so they probably have a lot of yes. So I did speak to a colleague, and so a few colleagues, because we have a peer group for the medical legal, and we were discussing it yesterday, and they actually said that they're doing more online assessments. So and so previously we'd have to go into the prisons, but a lot of them are doing online assessments. So I think that's what has happened. So people are actually not allowed to go to the prisons, even the visitors. I think that would have changed. They might have started a lot of online sort of visitations or meetings. So I think the prison staff have done well. But obviously, in terms of vaccination, it is important that they have every right to get the access to healthcare and to the vaccine if they are supposed to be getting it.
And the last story is about the fact that this pandemic has produced a lot more rough sleepers. People are sleeping really rough, and times.
Yeah.
More. And the reason, of course, I was going to ask you, what do you think is the reason is? But answering my own question is because people have lost jobs someday. People have lost jobs, and people, I don't know, and some other reasons that people are, out on the streets sleeping rough and all that. People have lost their homes. Some have lost their homes. Yeah.
Yeah, I think it's a combination of factors. As you said, it's a lot to do with the finances and social circumstances of a person, which has led to them being on the streets and being homeless. I was actually watching a video sent by Dream Sai, because we usually do the donation for food for the homeless in the Milton Keynes. So Dream Sai is
I know you do that.
you must have seen we've cooked
Yeah,
a few
I see it
times.
all the time. Yeah.
Yeah. So they actually sent a video of all the what they've done over the pandemic over the last year, and it's alarming. A large number of people that they've had to feed that are homeless. So the figures are real, and I guess it has increased because of the fact that we are in a lockdown. A lot of people have lost their jobs, as well as their family situation, relationships have changed. People have obviously succumbed to illnesses and mental health issues, so whether they've had addiction problems, so there's been so many different illness, so there's been so many different factors that has resulted in more and more people becoming homeless. But having said that, Apoko, I must say, during the lockdown, like if you had previously, I don't know about you, but if I'd gone into London or gone into Milton Keynes, you'd see a lot more of the homeless outside. So like at the station, or, in certain areas, I don't want to target anyone, but just to say, like certain areas where you would see people, you'd see the homeless and they'd be there begging. But now you don't see as much, even though the numbers have risen. I think what has happened is a pandemic has taught us to be there's so much more kindness, and people are so much more giving, that even though we're all going through this together, people have actually reached out to people less fortunate. And so like we've been donating, other people have been doing it, you've been helping out as well with your families with the food. So I think even though there's so many more numbers, I mean, not to say that this is like a positive, like, it's a positive outcome, but I do feel that people are a lot kinder, people are a lot giving, and they've actually offered more help to homeless people. So the position in which the homeless people were before is not as how they were like a year ago. It's very different, And also bearing in mind, we've reported a lot where even hotels have been converted, like the Travelodge or Premier Inn. They actually, or the Holiday Inn Express, different hotels in the country actually provided, because they were locked, they were not able to serve the public. They were actually open for the homeless. So I do think, hopefully, fingers crossed, and for everyone that's thinking along the lines that we do, helping others, and, taking a step back and thinking how fortunate we are in this time, to be safe and to be with our loved ones, that we do need to think about, offering our help in whatever way, shape or form, whether it's a donation, whether it's your time, it doesn't have to cost money.
No. Even a smile, that's all that will do.
Yeah.
Anyway, shall we do the numbers now?
Yes, sure. So the COVID-19, the numbers. So in terms of the numbers, we have, so I'm just going to refresh the page. If you just give me a second. So in terms of the numbers, we've got 121 million. 200. So today is the 17th of March, 2021. Apoko, just give me a second. Sorry. My apologies. That's never happened before.
Yeah, but it doesn't matter. I mean, if you got to go, you got to go.
No.
Yeah.
I put something on the stove. I was cooking breakfast for the family, and
yeah. It's more important that you keep safe and you don't.
No, I heard it sizzling away. So I thought We still want to eat it for breakfast. So 120, my apologies. So 17th of March, 2021.
Don't worry about it. Don't apologize. We're all right. Yeah.
121,291,579 positive cases. So that's globally as of the Worldometer of today. Total number of deaths is 2,682,559 positive cases that have died. Total recovered 97,823,863. So that's the figures as of today. USA remains number one with 30,231,550 positive cases, with 549,367 deaths. Brazil, number two, with 11,609,601. And as we said yesterday, they've overtaken from India. There was a news story about it, so I did want to say it, but you want to do the numbers. So if we can go back to that story in a minute. So 282,400 deaths. India number three with 11,438,734 positive cases, with 159,079 deaths. Yeah. Russia number four with 4,409,438 positive cases, with 92,937 deaths. UK 4,268,821 positive cases, with 125,690 deaths. And South Africa is number 16 with 1,530,966 positive cases, with 51,560 deaths. And Ghana number, I think it's still the same.
88.
Yeah, so number 88 with 88,228 positive cases and 698 deaths. So Ghana's doing quite well still.
Before you do the 24 hours, just double check what it's like in the Philippines.
Oh, yes. So let's, Philippines is number 30. Yeah. Number 30 with 631,320 positive cases and 12,848.
Okay. It's got the second. Did you say it's got
second highest in Asia? So Indonesia is.
Indonesia is up there.
Yeah, 18.
Number 18.
Yeah, with 1,430,458, with 38,753.
Okay.
Yeah. Maybe tomorrow we can read the top 10. Because I think it's still significant, the top 10, because a lot of people are thinking about holidays and traveling, and some of those countries are in the top 10. So in terms of Brazil, so São Paulo health chief urges lockdown as COVID death surge. So Brazil is standing at number 2 in the Worldometer, and health officials in Brazil, most populated state, São Paulo, have called on urges for the new health minister to impose a national lockdown as the coronavirus deaths continue. So it recorded on Tuesday, recorded 2,841 COVID-related deaths. That's the highest that I've heard of.
Wow.
That's quite high.
That's high. That's really high.
And of all of that, 679 was from São Paulo. So I think this is where the concern about the variant, the P1 variant from Brazil, has caused concerns. So Marcelo Quiroga has been given the job on Monday by the president, Jair Bolsonaro, who faced widespread criticism over his handling of the outbreak. So we've spoken about this before. So President Bolsonaro has consistently opposed quarantine measures introduced by the state governors, arguing that the collateral damage to the economy will be worse than the effects of the virus itself. Okay, I'm not commenting on that, but there you have it.
I'm not commenting on that as well.
So, I mean, obviously, Mr. Quirego has urged Brazilians to wear masks, wash their hands, but stopped short of endorsing a lockdown or social distancing. So this is obviously a concern. Yeah.
Yes, it is.
And I think we reported last week. Did we report last week where we were a bit surprised where President Bolsonaro was telling people to stop whining about COVID-19?
Yeah, that's Bolsonaro for you.
No comment.
Let's show you the 24 hours. Let's see what the numbers are like in the last 24 hours.
Yeah, we'll do that. So no comment. So UK, yeah, the figures I did see, obviously, and we read it out earlier as well, it's 110 new deaths. So every life matters, but definitely much lower. And then the total number of cases is 5,294. In comparison with yesterday, was 64 new deaths and 5,089 cases. And then the day before that, which was 52 new deaths with 4,618. We are moving in the right direction. And very soon we're going to be reporting zero numbers, zero cases, zero deaths.
Very soon, no COVID updates.
I know. I cannot believe it's that the year has just gone.
I'm really looking forward to that day. I'm really, really looking forward to that day. And I think I'm going to try and contact the doctors who came to talk, the GPs who came to talk.
Yes, that would be good.
I'm going to try and see if I can contact them today. So
Dr. Linus, yeah.
And explain, especially this AstraZeneca situation,
I think that will be interesting, and especially because they're dealing with firsthand. And like you said as well, if depending on what you were going to do, you were going to ask your GP, which is exactly what I said. Speak to your GPs. A disclaimer from us, from myself and you at Hospital Radio Bedford is, speak to your GP, speak to your healthcare professionals, have a look at the information online and find out the information and make your appointment and then go for your vaccine if that's what you want to do. But obviously, if you're not taking the vaccine, then that's the decision that you make. So everyone is entitled to make their own decision. So I mean, we are not saying go for it or don't go for it. It's every person has to decide. And depending on which one you get, it will be, again, your decision as well. Hopefully, you'll be given that opportunity to decide as well. Thank you so much, Apoko. I'm on my way to London again, to the Mahikari Centre on the train this time. So hopefully it'll be a good journey, and I'll keep you posted on what I see today.
Have a great day.
I'm sure it's going to be very quiet. It's so we have to go on the train today, together one of the days, because it's such a surreal experience. It's so quiet. It's so different. I think you'll be amazed that that's London, because I think you've been here longer and you go into London quite frequently. So it's so different.
All right, Dr. Seshni, but today we got a whole beautiful lineup. In fact, we've got a new show coming up, a request show.
Oh, wow.
From actually Afternoon Tea with Sue Comnius, which is from 2 to 4.
Amazing.
And the first hour of that show, she's gonna do some requests. So if you wanted a song played for you, just send her an email, or just send her an email to studio@hospitalradiobedford.org.uk and ask that she plays you a song.
Oh, lovely.
Yeah. Thank you very much.
Studio at hospitalradiobedford.
Studio@hospitalradiobedford.org.uk.
Oh, lovely. Okay.
Yeah. All right.
Okay, thank you so much, Apoko. Hope you have a good rest.
Yes, I will have a good rest. Don't worry.
And I will report on my trip to the Mahikari Centre, Secure Mahikari Centre in London, how it went. Okay, have a fantastic day and lots of love to everyone.
God bless.
Thank you so much. Bye. Thanks everyone for joining the Hospital Radio Bedford, and stay safe. Namaste, guys. Have a fantastic day.